You're listening to the Residential Movement, where the focus is on making in-home dental care normal instead of novel or niche. I'm your host, Dr. Ashley Robinson, a house call dentist with a lot of passion for reaching patients who are best served in their home or residence. I'm here to encourage, equip, and empower dentists like you to begin offering in-home dental services for patients who cannot get to the office, while also enjoying a more balanced work life. We discuss everything from dentistry, business, ethics, mindset, and more. Listen in to learn how you can become a part of the residential movement. Patients can be unreliable. We know this. Not intentionally, they're not ill-meaning. Even in the age of the internet, when a lot of patients actually do have a high dental IQ, a lot of patients still just don't know exactly what they're talking about when it comes to their teeth. And they definitely struggle to know what's going on in another person's mouth when they're the caregiver. This is totally fine. It isn't their responsibility to know dental terminology. But this presents a challenge to us dentists, especially house call dentists. For example, when a new patient calls my practice, they might tell my assistant that they have a, quote, loose bridge. Now, my assistant will make that note, but we know very well that the patient could in fact have a loose bridge, or it's just as likely that they have a loose partial. In a brick and mortar practice, when a new patient comes in with a self-reported chief complaint, even though you don't know exactly what's going on until the exam, you can relax knowing that you have access to 100% of your dental instruments. So the chief complaint for an in-office visit is kind of irrelevant until the patient arrives. In my house call practice, the lack of reliability can present a real challenge for packing. It's challenging, but it's not impossible. I just have to think ahead. So let's think through what I might do in the case of a new patient with a, quote, loose bridge together. If I were to take the patient's word for it, I'm packing cement and the instruments that would go with their complaint. So an explorer, floss, a curing light, cotton rolls, articulating paper. Then I have to consider what I'd need if it's a loose partial. So let's grab the 3-prong pliers and maybe reline material too. Or what if it's a loose bridge because we have non-restorable teeth involved? I guess I'll need to grab some PAs, so I'm going to grab the radiograph stuff. You see that you need to come prepared with a lot to address a new patient's chief complaint. This can also be a challenge with existing patients too, but at least when you're packing for existing patients, you have the benefit of an odontogram. The wife of one of my comprehensive patients called to schedule an appointment for her husband because according to her, he has a, quote, broken front tooth. I checked out his odontogram and one of his front teeth is crowned while the other has an existing resin. I haven't seen him yet, so I can't really tell you what's going on, but there's a chance that she could be referring to his crown falling off or a broken resin. So I intend to pack the restoration armamentarium and the crown replacement instruments too. I'll also pack impression material in case this is a broken tooth that can't be replaced, and maybe we have to discuss a flipper. I really try to think ahead. Now, you may ask why my assistant doesn't just spend more time on the phone asking clarifying questions. I've actually advised her not to. We don't want to insult a patient with questions that could sound distrusting of their report. And truthfully, even if she did ask, who's to say that the info would be even more reliable? We might just end up having more unreliable information. Because of this, we always share the caveat that we can't guarantee that any treatment will take place until after the limited exam. If I'm prepared to do treatment at that exam visit, which I always try to be, then I can do it at that same appointment, but I may also have to return. Patients understand and really appreciate this. This happens most often in the case of new patients who call with the request to come over and fix their loved one's broken tooth. Usually after limited exam and x-ray, I have to tell their loved ones that that tooth is actually non-restorable, and then I return a different day for the extraction. They always totally understand. I've also been asked why I don't use teledentistry more to eliminate appointment visits. Now, I only offer teledentistry to existing patients that I've already met in person for an exam. Images sent in by patients as a supplement to my own exam and images can be helpful. But there are severe limitations to teledentistry as a patient image alone is not always diagnostic. So yeah, it's wild that for one chief complaint, you might pack enough instruments for 3 different procedures, and you could still be wrong about what treatment is needed. My husband is an electrician, and this is something that he totally relates to, but the average person doesn't realize how many instruments go into one procedure. New patients will call without chief complaints just for a comp exam and hygiene. So when I roll up with my pack out, they'll say, all of this for a routine visit? Well, yeah, even a routine visit doesn't happen without gloves and gauze and everything else. A radiograph doesn't happen without a laptop. I mean, there's no such thing as a quick and easy appointment. It all requires a lot of thought, a lot of instruments, and a lot of preparation. I hope this was helpful for you as you begin to think through the procedures you'd like to offer and how packing will go. This is something we discuss in depth during Dental House Call Practice Academy. the online course that takes you step by step through building your dental house call practice. Visit residentialmovement.com/DHCPA for more information. Or as always, feel free to email me at hello@residentialmovement.com. Thank you for listening in today, and thanks for considering house call dentistry as a career. I really appreciate you. That's a wrap on this episode of The Residential Movement. If you like what you heard today, please leave a 5-star review and subscribe so you don't miss an episode. If you know someone who could benefit from this information, please share this with them. All of these actions help fuel the residential movement. Visit residentialmovement.com for show notes and for access to any links referenced in this episode. Thanks again for listening, Doc. Keep up the good work.